Welcome to the University of Washington Tracheotomy Care Training video module on side effects and complications related to tracheotomy. By the end of this module, we anticipate you will be able to understand the difference between side effects and complications of the procedure, describe some expected side effects of having a tracheotomy, and list several complications associated with tracheotomy. The tracheotomy procedure affects how you breathe, and as a result, there are several expected changes that you may experience to varying extents. These are called the expected side effects of the trach procedure. Complications related to a procedure are unpredictable adverse events that can occur. Some complications are more common than others, and we will discuss the more common complications in this module. Since placement of a trach tube changes how you breathe, it changes how the throat functions. For this reason, you will experience some of the following symptoms to a variable extent: inability to talk while a cuffed tube is in place, effortful speaking, inability to smell because air does not pass well through the nose. This may also affect the sense of taste, discomfort or difficulty with swallowing, mucus drainage from around the tracheotomy site, coughing from irritation of the airway by the trach tube, drying and thickening of the secretions from the lungs since air is no longer being moisturized by the nose. A humidifier or attachment to the trach appliance can help with this, since drying of the secretions can lead to crusting, mucus plugging, and bleeding. Your nursing or other care providers will help you after a tracheotomy procedure to adjust to these changes. Most patients learn to accommodate these changes and quickly become comfortable with the new tracheotomy. We will review two types of complications of tracheotomy: the complications that occur during surgery and those that occur after surgery. With any surgical procedure, unexpected events can happen. Severe intraoperative complications from tracheotomy procedures are uncommon, less than 1.4% in one large multi-center U.S. study, but they can be life-threatening. These include a drop in the oxygen level during anesthesia, stroke or heart attack, a punctured lung, significant bleeding, or even death. Complications that occur after a surgical procedure are called post-surgical complications or delayed complications and occur in less than 15% of patients. The most common complications are listed here: bleeding, blockage of the trach tube with mucus called mucus plugging, infection of the trach site called tracheitis, accidental displacement of the trach tube out of proper position called accidental decannulation, formation of reactive tissue around the trach site called granulation tissue, damage to the tissues of the trachea and nearby structures due to the chronic presence of the trach tube. This can cause scarring and narrowing of the trachea or weakening of the tracheal walls over time. In this module, we describe the possible side effects and some of the complications that can occur after tracheotomy. The side effects and complications described above must be weighed against the alternatives and benefits of tracheotomy, which typically far outweigh the risks and consequences. It is important to discuss any questions or concerns you have with your medical team.